Now I would like to introduce my special guest. I've got the Sandy man. Sandy knows lots and lots. He's done lots of research.
MS for 20 years.
MS for 20 years. Anything you want to know, Sandy will answer it. And we've got Elaine.
Hi.
Elaine does a bit of poetry, really good poetry, but she's also a CB counsellor, so broken but mended, if you see what I mean.
So, we're off?
We're off. Sandy, I'll ask you a question first. You've got a good analogy about the sick cat. Would you be able to explain?
Yeah, I've got a friend called Stuart. He's a lift engineer. He was one of the guys that we rode motorbikes once upon a time. He was an engineer. I was an engineer. And Stuart pops in to visit once every month or a couple of months. And when he does, he'll fix that light that I need changed, or fit that bulb, sorry, that I need changed, and anything tricky that I'm struggling with. So he's a good friend, and my girlfriend was worried about this guy because anybody coming in my environment, I'm really struggling. So almost like she was trying to keep people back because I was, I'd be I don't tend to say the right thing.
Just shaking a little bit different.
Oh, definitely. But meeting you two folks at the class was good because when you're getting sent to a hospice, you're thinking, oh no, that's where people go. You say adios, it's God's.
I had that same
departure lounge.
Same thought as well, Sandy.
But we sit off the back, there's like a conservatory, and then meeting a lot of like-minded people that have some neuro problems, but that be Parkinson's or MS, or I've met some people that had a stroke or that. Just talking to these different people, suddenly there's a sort of caring vibe in the place. And you know how much we
all help each other.
We look out for Brian.
Yeah.
He's out cutting down trees.
Brian's an elderly gentleman. He's always smartly turned out. And he comes to our strength and balance class, which we're just back from. He puts the rest of us to shame. He always puts a right good shift in.
He's very flexible.
He's very flexible. Just when we were talking about the strength and balance, that's something I've found really useful. It's at St Andrew's Hospice up in Airdrie. You get a referral from your MS nurse, and it just exercises to prevent you falling over, basically.
Well, I was falling, so I'm not falling now, but I put it into Joe and my own exercise, which is going down the stairs. I've got 2 handrails, and I put my weight in my left leg a lot more, and I do a sort of press up weight at 10 at the bottom. So a couple of months later, I'm not falling now. So
no, it definitely helps.
In the class, people are, I can't do that. And it's like, move it that 5 millimetres, because next week it'll be 10 millimetres, and we've all noticed a wee bit better. But we should really mention our other classmates that are on our WhatsApp.
Yes.
There'd be Helen.
Yeah. Lauren.
Helen's, how will I put this? She's the youngest acting gran that I know.
Yeah, she's really good.
She's got 3 grandkids.
Helen with the good hair.
Aye. That's how Sandy remembers her. But we've got a WhatsApp chap, and Helen's always thrown in stickers, and she's very good.
Well, I don't talk to anybody with WhatsApp because I'm confused about what's happening, but with my neurodivergent people that I've met, I feel fine because we're all saying stuff wrong, or at wee Davey.
Davey, he's one of the good guys.
He's got Parkinson's.
Parkinson's. Next day, Dave, he gets called, because sometimes it takes him a while to process what you're talking about. And it was Dave that came up with that name. But he's a funny guy, very funny guy.
Is that it then? It's
Lauren. We've got Lauren as well, haven't we? Aye.
It's mad because I know that Lauren's got trouble with her legs now.
Aye.
Which if you said 20 years ago, you'd think it was something dodgy going on, but it's not. The sort of care and the warmth that's in this place and amongst us is definitely like a sort of glove.
Yeah. So I found out about the strength and balance because I went to the monthly Lanarkshire MS meeting. Laura hosts that at St Andrew's Hospice, 3rd Thursday of every month. So I would recommend, if you've got MS.
It's a great group. That's where we met.
Yeah, that's where we all met. And that's who recommended the strength and balance, etc. Mm-hmm. So 3rd Thursday of every month, you get a cup of tea and sometimes a chocolate biscuit.
It's the 17th this month.
17th of this month. There you go. Well done, Elaine. So Sandy, we're still waiting to find out about this sick cat.
Sorry. Yeah, so the friend, Stuart, pops in from time to time, and he was talking about his sister who was visiting from abroad, and he was annoyed because she had a cat, she loves cats, she was looking after this wee cat, and she goes back to the pound when it dies and gets another cat that's ill. And he says, why did she do that? She's in a foreign country, she likes cats, And she gets the cat that needs expensive medication, it needs the operation, and she looks after that cat. So that cat wouldn't make it if it wasn't for her. And at that point, my girlfriend turned around and said, you're Stuart's sick cat. And I said, what? She was right. Because he's looking at this fella that we used to be a lot friendly because we were cutting about in our bikes and being able to go to nights out and things. But Stuart pops in, so it maybe makes him feel good that he's looking out for, his sick cat. And at which point my girlfriend said, and Stevie is your sick cat. I went, oh dear, she's right. I've got a pal, Stevie, that's really ill with MS now. He's in a chair, he can't move, and he hates the world and everything that's going on. And I try to give him some other light to that. He says, why do you talk to me? And I says, because I get to tell you everything. It's like a counsellor.
So good to reach out.
My sick cat is the counsellor. He's not telling me stuff. He's letting me just spew my guts about everything. For if you're not making it to the loo or anything in the world that's going on, relationships, family, whatever. And it's exactly what I'd got when I went to Revive and spoke to Alan, the first guy I'd seen. And it's funny because it was Stevie who was more well then that sent me to see Alan. And I'm thinking, Alan didn't give us advice. He told us things like, right, if MS, if it's got a nerve, it can be affected. So that's your skin, your hair, just about anything in your body. And Stevie looked at the world a bit more like there's nothing you can do about it. Whereas you can see us just now with the strength and balance. I mean, a lot of people don't like the class because it's painful doing the stuff, but if you keep doing it, you can keep going. So anybody out there, keep moving.
Yeah, totally right, Sandy. So the title of the podcast today is Make Do and Mend. We are making do, we're mending.
There's also a Tai Chi class.
Tai Chi. I've never made the Tai Chi class yet, but the Tai Chi class is on a Friday morning. Joe, who takes the classes, he's wonderful. But I just imagine with his Hong Kong Fu at the Tai Chi.
There is a bit during the Tai Chi, and it's called Tai Shower. It's like, remember you put your hands up and you have to run them down the side of your body, and we were trying to work out what it's called, and I was saying to Helen, is he saying he's selling? You're like, body. You think I'm sexy? Nothing. And so she's kind of laughing. And you can't tell somebody else that unless they're rare and appreciate it. So I hope I've made some people...
Oh, that's made me smile, Sandy.
I worry it's like a sales podcast who it's really popular. Suddenly we wouldn't get in the class because it's actually over.
I know, it's getting busy.
Now, but
you might be getting popped out. I'll talk about St Andrew's Hospice. Another service they provide is the complementary therapies.
Pauline and June.
Aye, June, that's the one I was looking for. So Pauline and June, fantastic. You can get a referral from your MS nurse again. Massages, Tai Chi, crystals. Reiki, fantastic.
The foot thing, is that
right?
Reflexology.
Reflexology, aye. So excellent, I would recommend it. My last session, I fell asleep. I had a massage, then we turned round and we did the Reiki, and I was sound as a pound, sound asleep. And I just think that June could have painted my face like a clown. And I would have got up and left and I wouldn't have known anything about it. But luckily she didn't. So I definitely recommend June and Pauline, fantastic people.
If you're referred. But I'm not ashamed to say, but I've had different therapies. But when Elaine did the back massage, she used who's the stuff that brought Jesus?
No, the oils. Oh, the...
frankincense.
Aromatherapy oils, and they use crystals.
Well, just on the back of this, and it's really quiet. That room was perfect.
Aye.
When that lady started massaging me, I wept for about 3 minutes. That's how beautiful it was.
Aye.
I think it was the whole setting and the build for it. And we'd got to know each other over the years, so you don't normally get to know somebody that's going to work in your feet, whereas we'd spoke a lot.
Aye.
So, big shout out to...
they do wonderful work. They also spend a lot of the time with the patients upstairs.
And then Sister Catherine, we meet Sister Catherine in the
Sister
classes
Catherine,
too.
wonderful person. Sister Catherine, elderly woman, but she does her classes. She does the hospital visits. She goes round and she assists people at the later stages of their life.
I've spoke about the place. Let's talk about MS. So, you folks have had it for what?
Well,
3 years?
Not even a year yet, Sandy.
Oh,
I'm a year and a half.
Wow.
What are you, Sandy?
when you two folks are 70, that's how long I've had it. You know what I mean? I've had it forever. And when I got ill, it was in the family. Dad's brother's girl died. She got it at 32 and she died 4 or 5 years later, which is really uncommon for MS. But when I got it, it was an extensive damage to the brain and I feared I'd go down that route. But what I was more bored was how it affected my dad, because he was going to watch his boy going downhill fast, because I can remember every week, she can't do this now, she can't swallow now. And the irony is that she was a radiographer.
A radiographer, yeah. I remember you saying that.
And a procedure I got, an interventional radiologist can do, where they enter your femoral vein and they went up and opened my 2 jugular veins. That was in 2011.
You paid for that yourself, Sandy?
Yes, 500 quid for the scan from Dr. Gilhooly, who is in the Rutherglen Essential Health Clinic, and it was to get an operation that opens the veins in your neck. It was referred to as I'll say the letters first, that's CCSVI. It stands for chronic cerebrospinal venous insufficiency.
Well done, Sandy.
Pretty much the blood that goes to your head is oxygenated. When it's used, it comes down to veins in your neck. You know the jugulars you can see that are when somebody's raging? Well, that's the return back down. That's not your blood gone. The blood goes inside, closer to your spine. Anyway, the 2 jugular veins in people with MS tend to be narrowed. And so I thought, wow, I'll look at this. I wasn't looking for a fix. I was just looking not to get ill fast, but it was quite profound. When they open the veins, it's not an operation, it's a procedure. It's not dangerous. You're actually awake through it. You've not got any, what do you call it?
Anaesthetic?
No. They give you something to numb you up, but you're not out for the count. They want you awake when they're
You're
doing
not
it.
sedated?
But sedated in the sense that he tried to offer you something to keep you calm, but he said to me that I was too calm already because I was looking forward to getting it done because I wanted my life back. And it gave me my life back for about 2 or 3 years, and suddenly everything started going downhill again. But it did make me go forward and start a family with my then fiancée. Unfortunately, I didn't work out, pretty much due to the MS. I do have been with a girl for 12 years, and I don't want to say too much, but it's no brilliant in a relationship when your brain's not working when it's meant to.
So I think you feel like you're Jill's sick cat, Sandy.
Exactly.
And I'm pretty sure that's not the case.
No, but what I realise is that Jill is now looking out for me like a carer. And being a carer, it's like you bring I made a sausage casserole in the slow cooker. We live apart. I mean, she's got her own place. But when she was bringing my plate to me, I seen that it looked quite disturbed, and she went, "I cut your sausages for you," you know. Or she brings the fork that's got the big handle that I can use. So she's looking after me a bit like you might do a child.
Aye.
Remember, it was Nina Cherry, man-child, the tune.
Aye.
Well, that's me. And Jill, unfortunately, didn't become a mum. So this man-child she's looking after, it's weird that I'm filling some niche for her.
I'm pretty sure you're a special person to Jill, Sandy. I'm pretty sure you're not the sick cat.
But we're fantastic together. The thing is that I'm thinking, I said one night when she brought something for dinner, it was so good, it was cola chicken, and I said, "See, when you get a boyfriend, will you still come and make this and eat it with me?" And I thought, that's going to be a funny dinner, innit? Right, well, say hi to Mark, you know. But I mean, these are words that I've had, but I tend to talk before I think. So it's good to have her around because she normally shuts me up.
No.
But you'll be looking after her as much as she's looking after
Well,
you.
I like to feel that, you know, I'm there. She made it clear that I have to go out forever. It's just hard when you're so broken. I mean, like you're talking about no lifting the heavy bags, but
Aye.
I was kind of handy about the house, and now I can't plug a USB plug in. You know,
I know. It breaks my heart.
there
I
must
mean,
be.
we just help each other. That's what we do
Yeah,
in the
but-
class, and we go to the cafe and we look out for each other.
I would recommend the cafe at the hospice if you've never been.
What about folk that are not going to be going there that have got MS and they're now thinking they're looking for a fix? What can help me? So you put your hands in the professionals and the neurologists that are going to do this, and before you know it, you're on disease modifying therapy, which is you're into hospital for, and nobody wants to get that done, but it slows down progression by 40%. I started this stuff 20 years ago. It was called beta interferon, and it was 30 grand a person, and we now know it was 8% that's slowing it down. I worry how much money comes into it when you look at some of the companies, because the new one, it was Elaine
Yeah, I'm on Ocrevus, and
Yeah,
it helped me for the
but
first 6 months,
you
and now
told-
it's not helping me anymore.
You told me the cost of it was
20,000 per patient
Jeez,
for the year.
These companies are making a fortune out of it, Sandy.
But at the same time, that's where your pension's invested in that bloody company, that you're getting a better return. But I looked a bit different at MS because I was getting it pretty bad and it was going downhill. So I found something called naltrexone, LDN. People listening won't remember stuff, but LDN is what you see in the train station when you go in for London. So remember the London abbreviation LDN at the train station? Type
Was
it.
it low dose narcotics?
Low dose natroxen.
Low dose naltrexone. Naltrexone's an opiate blocker. 50 milligrams a pregnant woman can be prescribed that to help stop drugs with no harm to the baby. I went to my GP and said, I want 3 milligrams of that. And he went, what? And I said, I know it needs to get special made, I want it. And he got it for me because I'd done a bit of homework and said, I want to try this. Because this American lady, Sammy Joe, was talking about it. And I thought, nobody's making a buck here. Everybody's got a snake oil, get this will help you. But no, naltrexone at that low dose really did something. I think it saved my life, to be honest. I don't believe I'd be here 20 years later had I not went down that route, but I'm not saying people to jump in this, but look it up. YouTube's pretty good. Gives you loads of information. Even the guy off the TV, I don't want the pharmaceutical companies to kill me. That guy that was on the telly, what do you call him, Dr. Chris Steele? He did a video 8 years ago about this drug. Well, I was only 8 years before he done it, but look at YouTube. It's the man off This Morning programme, wire-rimmed glasses, nice man, Dr. Chris Steele. 6 minutes is all it takes. Watch that, it'll blow you away, because naltrexone does no harm. Day one for a doctor, you're taught to do no harm. This drug does no harm. Why don't we try that for bloody MS? I'm 20 years going, I wouldn't have been here, I believe, had I not went down that route. But I want people to stick with whatever treatment you're doing now. This is stuff to look at down the road.
We're a bit worried that when we leave here, Sandy's going to get a bullet in the head from the pharmaceutical companies.
It was that boy off the telly. It was that doctor off the telly. It was that man. The fact I did it 8 years before he did. But I've not seen him since.
He got a bullet through the head, Sandy.
I feared that we should have Google searched it first.
Elaine, you've been getting your disease modifying treatment.
Yeah, I started it
Therapy.
in November.
Therapy,
Disease
sorry.
modifying therapy. I started it in November. I never had anything for a year, so I was diagnosed a year before that. And they said I wasn't eligible because I've got primary progressive MS. And with primary progressive MS, this is the only treatment you can get. And you need to have radiological activity seen on the MRI. So by the time I had my next MRI, the month before that, I had a lot of activity. So they sent me for this treatment. The first time I got the treatment, you get it across 2 half doses. You're in the Queen Elizabeth Hospital for 6 hours, and it went well. I felt great for about 4 months. Felt a bit lethargic before it. You go through the crap gap before it, where you feel like crap for about 4 or 5 weeks. And then when I went back this time, I've not felt better yet. So my disability's got a bit worse. My mental health was really poor for about 4 or 5 weeks. So I'm waiting to see if it's going to pick up. I don't know at the moment. They've not done a lot of research into Ocrevus for primary progressive MS. Most of the research is focused on relapse remitting.
So there's a different one for relapse remitting.
It's the same drug, but they've not. They gave it for relapse remitting first, and then they trialled it for primary progressive, but they've not. It's not been a large trial. They've not done it in a lot of people, so they don't have as much evidence for primary progressive. But I wanted to try something. I felt like I was doing something by starting the treatment.
Definitely. I mean, as I said, 20 years ago, that's why I was taking, at the time it was called Copaxone. It was an injection, intermuscular, which is a bloody tetanus once a week. And when my legs were black, I moved on to Reba, which is a 3 times a week one, Monday, Wednesday, Friday. And I didn't notice anything with it, but the reality is that was 8% effective at slowing it down. They said 30%. In other words, if you get 3 attacks in a year, well, you'll only get 2, because this is going to stop one of those attacks. And the new one's slowing it down by 40, which is great if it's doing that. I just know that last stuff I was taking, which was horrendous, because you were getting your blood checked every month to check your liver and your kidneys. But as I say, I'm moaning about something 20 years ago. You folks are going through that new stuff now, so I want people that are on it to stick with what they're doing. But as I say, I came at this a bit different way. And I mean, 20 years on, I don't take any drugs apart from a couple of amitriptyline when I go to my bed, Oh, and I also get Sativex, which is a oral spray, the controversial cannabis spray. I was one of the first to get it, and that was good for pain. You start off with one spray. 3 sprays is the magic number for me, because I did that before I came out the door today, and suddenly I don't feel like I'm stepping on a spaceship into the world that's going on. I've got this sort of blanket because that cannabis thing sits on it. People think cannabis, oh, that's bad because they know, but once upon a time, that's what the doctor would make an ointment with that, and that you would rub in your arm to make that sore shoulder better. Ralgex that you spray that does it nowadays is made in a lab, and your body's not seen these chemicals before. For a millennium, the cannabis has been used and stuff, and we've seen it, your body's seen it. The worry for me was that MS is your body attacking itself. Why is it attacking itself? I'd be putting the wrong bloody fuel in it, with these medicines that we're taking. I know I like Western medicine, it saves lives, but don't knock the cannabis. And my dad was very against cannabis because he used to play in bands. And as soon as I showed him what it actually meant to a lot of people with MS, he was very much on side, to the point where now, I don't know if you've seen the advert on the TV, it's called Curaleaf, the company. It's the word cure and leaf after it. Yeah. But pretty much what you're doing is getting prescribed cannabis legally. You've got a £50 every 3 months appointment with a doctor to make sure you're not going loopy. But I get a delivery with the DPD van with your Amazon stuff, comes a box, and that's cannabis. And it's funny because it's not to smoke it, you have to vape it. It was something I discovered, as I say, 20 years ago. I was in a lot of pain. In America, for chemotherapy, which is really painful, they've got a machine called a vaporizer, and what that does is it fills a bag with the air from cannabis. It doesn't burn it. It takes it to a temperature. The machine's quite expensive. In fact, Curaleaf sell the machine. So now you actually don't pay VAT on a bong. You know what I mean? Which is incredible. I mean, I bought it 80 years ago, but you can't put the stuff you used to buy then through it.
I'll need to tell that to the guys down the park. Claim back their tax.
The legal stuff doesn't have any stems, leaves, seeds, any of the crap in it. In fact, at one point, folk that were getting the dodgy stuff, it was white, it looked good. It was silicone spray that you put it, an aerosol sprayed on it, and look at that, that's no good. I asked a friend, how do you know that's been done? And he says, get the bud, touch it off your tongue, and put your tongue in the back of your teeth. And if it's gritty, it's been sprayed, bin it, send it back, get your money back. But no, I'm 5 years now getting stuff off Curaleaf, and it uses quite a lot of stuff to fill the bag with the air. And it's green when it comes back out because you're just heating that up. I don't want to go off in some, but I could see Helen now going, oh, there he's talking about drugs again. Remember I showed her a bag with it. I get these jellies as well because you don't want to build the machine up, you're feeling lousy. You can eat a jelly you get from them. But the doctor says, you don't eat a full one. I'm thinking, I'll be fine, I've had it before. And he says, no, a full one. You cut it into quarters, and it's about the size of your thumbnail. Aye. And you have to eat it a quarter. But you can eat a full one now, and but don't do it in the sun. Because my 80-year-old neighbour had to help me back in the house. I was sitting at his house talking to him, and in fact, there's Stevie phoning me now. My pallet's in the sea. I've put my phone in silent, and Stevie's phoning me. Steve, if you're listening to this podcast, you just phoned me. So, sorry I digressed, bud, but I don't know where I was even at because
you were talking about the jelly, Sandy. But I remember, before you told me you had a couple of mates over, and one of them took 6 sprays of your magic.
No, we're watching the Old Firm game.
Glasgow Derby, Sandy. And
a boy with a Celtic top stole a shot at it when I went to the toilet. So my other pal said to me, I came back, he took your stuff. And I know the guy, I said, silly, she did just ask, he smokes the stuff. And I said, how many sprays did you take? And he said, 6. And I went, oh. And he says, what? I says, you are going to see stuff. And he said, what do you mean? I said, but he's a taxi driver. Shout out to JK. I said, go home and don't answer the door. And he said, why? And I said, you will see stuff. But he said, no, he got a hire. He started driving the road towards, from Ballinacamps to Kirkintilloch. And he said, I had to pull over and stop because I seen monsters running in the fields next to me. And he told the guys, I'm not charging you, I've not got you there, but get out. So that was one of the stories you tell your pal in the quiet. The police will be there.
There's a guy in the DP van that delivers it, She get Bob Marley playing when he drops it off.
It's funny because I actually get them sometimes to open the package for me, which looks like I'm showing off. It's not. If it's a really heavy bag, I was like, hey, could you open that for me? It's the same with the cat litter. I get the 20-kilogram bag of cat litter, but I get the guy to bring it into the house. But these are things too. But no, honestly, you should look at it. Sativex is a spray, great for your GP. It's for pain. It helps with other stuff. My GP said to me, oh, thank you. He said, we've got so many people in full-time care now that are really abusive to their carers. And he said, no problem now, because he's gave these people the Sativex stuff, which means
they're stoned out in that.
You're pretty chilled. And I tend to go through the day where I said to the first urologist, who was brilliant, I liked the guy, when I had Sativex, I said, am I meant to be slightly stoned all the time? And they said, yes. I didn't say that. And I went, right. So
that's him getting struck off.
Well, the problem with MS is the peaks and the troughs in your day. It's the highs and the lows that make you ill. So don't get worked up about stuff. So if you're a bit mellow, it really helps. I'm straight as a die now.
No, that's great advice, Sandy. I've never met someone as horizontal as yourself. I'm putting it down to the medication.
Well, I take the Sativex before I come to the class, normally because going across the door, even going to Tesco's, that kid that's screaming or something that's happening that's bothering you, it doesn't bother you if you're slightly coated with Sativex. It tastes horrible. Shout out to MS Helen. She doesn't like the taste of it, and she just doesn't know 3's the magic number.
MS Helen, she attends strength and balance classes.
Aye, she was there this morning.
An inspiration. She attends the classes and she goes to her work.
Aye.
She struggles out her car.
Yeah, she
struggles.
She
with
should be retired.
She struggles with her walker, but she's an inspiration. No, that was great advice, Sandy.
What other things though? I mean, people are in pain a lot with MS. You feel like you helped somebody move house yesterday. You know, that's how I felt. And also, when you've got MS, you're thinking, how can I get rid of this? Maybe when you're a kid and your head, somebody taking your head. Well, your head, but look forward. I read all sorts of stuff. Think about it, for 20 years, as an engineer, I was in front of a computer every day. So, don't look up stuff in MS. Just go to Google, and they have a thing whereby you can enter news and put multiple sclerosis, and every day you'll get an email from Google. It's normally fundraising and stuff, but in there will be a nugget or two of information in MS. And that means you don't have to do anything. Just register with Google that you want news stories about MS, and you'll get an email each day. And that way you can be adrift of what's currently going on. But that's just some of the good things that I did early.
That's great advice, Sandy.
It's just to share what I learned then, because I said we've come up. Remember, I've said we need the words that I was using for my son. I had my son for he was born till he was 6, even when I had MS, but I didn't have him every Saturday and Sunday. He went back to his mum's. But with MS, you go to move, you would say a swear word because you were sore. So I had sugar, flip and bandit, and I sugar and flipped and bandit all around that house. And I thought the day if we were talking about anything that got heated, we could maybe go with, it's an absolute bandit condition.
That just means David doesn't need to use a bleep button. That's
is that perhaps?
Okay, we'll see if we can get it. Oh, there we go. So I've got that in standby for when Elaine starts her poetry. That was good advice, Sandy. The other thing I'd like you to mention
oh dear.
is